I'm Cheryl McCardle and I'm the Customer Services Supervisor.
I'm Liam Hines. I work at Kentec. I have done for the last 3.5 years.
So I'm Shushma. I work in the HR department.
I'm Kevin Swan. I'm Managing Director of Kentec Electronics based in Dartford.
I've wanted to do it for as long as I've known about Mental Health First Aid England.
My motivations was first to see signs if I can help people. I mean, I've got a brother-in-law who suffers with mental health problem and I never could see the signs.
I personally got involved because of the experiences I had in my younger life where I saw people who didn't have a good end at a young age, and it was due, I believe, to mental health and stigmatisms to do with their personal choices.
My real father, I've not met, but he was diagnosed with schizophrenia. So I've always, when I used to talk to myself when I was growing up, I used to think, oh no, am I inflicted by that? I don't know.
I found myself in crisis too many times out in public, and I've always felt that people should have noticed that I wasn't okay. But I was sectioned about 2 weeks before my 30th birthday. I was going to a mental health appointment about a previous crisis that I'd found myself in, and the practitioners of that appointment basically laughed at me, when I told them I could hear voices.
The course was brilliant. I mean, to not see some of the signs you didn't even know you'd be looking for. I mean, there was a lot of things there that I thought, well, I wouldn't have put that with mental health, or I wouldn't have related that to mental health, but it actually was.
You're better able to listen and then maybe guide when needed. So it's a very important tool that has practical experience that can be used very quickly.
There's a plethora of mental health topics that people can be impacted by. It's so easy for people to talk about going to the gym and talking about their physical selves, but why not their mental, their mental states?
And mental health isn't something you wear as a label. It's not as easy as a cough or cold or COVID, and people need to be aware what to look for.
I try and use those techniques that they give you to spot it in myself primarily.
Just opened my eyes and I just thought that was amazing.
It'd be good to sort of help others, and I think my daughter, because I'm quite an anxious person sometimes, she's picked up that anxiety, so I can maybe help her, hopefully.
I'd say do it. I mean, my daughter works for Kentec also, and I was saying to her about how good the course was, that she's now a mental health first aider.
I think the benefits to the people, to society and to the company are enormous in taking this seriously.
And I just thought that if I could get the skills to learn what to look for when someone's not okay, I could help someone the way I was feeling.